She's a doctor.
Hi, I'm Dr. Dovec, and she's a dietitian.
Hey, I'm Hannah Schuyler, and together we are the Weight Loss Collab.
And today we are so excited to bring Dr. Irene Tower back of BodyByBeauty. She is our cosmetic surgeon, and some of our own BodyByBariatrics weight loss patients have lost a lot of weight. They've had some body contouring that they wanted to have done by you, and every single one that gets it slides into my DMs the night of their procedure, and they're like, is this real life?
Yes, they look insane.
It's mind-blowing. Oh my God.
That's what's so wonderful about what I do, is because it's such an instant gratification.
Mm-hmm.
You know, it's like an instant change. It's right there. It's like one day you're got all this skin, the next day it's gone. It's like, it's mind-blowing.
It is mind-blowing. And I really do get the mind-blown emoji like over and over again, and people are crying. And not only that, they're writing me the day of too. So they're not really even in that much discomfort.
Right. Yeah. And again, like even that day, because we know it takes a while for it to like really truly look what it's going to be like. But even that day, it's like, oh my God, it's insane. It's insane.
Yeah, it makes it fun about everything. And you're right, people do really good with it. And it's shocking because you would think that it would be so uncomfortable. But I think we have like a good cocktail of things that we use in the OR and afterwards. And people come out actually doing really good. And the next day, they actually surprise me and they walk in and they're like, I'm ready, you know.
Yeah, someone was here early the other day for work. She came in at like 7 or something. And, we're right next door to the hotel that a lot of the patients stay at, especially the first night. And she was like, yeah, I saw the patient walking around at 7 o'clock in the morning, just walking, getting her food and getting her steps in already just to help, with that. And she was like, oh, good morning. Like, not expecting to see you right now. So,
well, and I think that's what we're going to talk about today is a little bit about the pre-op, the prep, how you just set expectations, but also how do you enable them to have this smooth recovery and all that you do to make sure that they don't just have a great recovery, but they have optimal results, especially with their healing, their nutrition, and, this is a huge kind of a comprehensive experience.
No, absolutely. And it's just important to be at the right time after your bariatric surgery or after your weight loss journey, however you've gotten there. You have to really be stable for at least 3 to 6 months. And this is something, even if you're going to use your insurance, they really hone in on that. They want to make sure that you're at a place where now that things are stabilized, your nutrition is optimized, and that you're going to do well with surgery. And that's one of the most important things. We want you to do well. And it always seems like a lot of bariatric patients will struggle a little bit more with wound problems and things like that. And we don't want you to have to go through any of that. So it's real important to optimize nutrition beforehand. So whether that's increasing your protein and making sure you're getting enough per pound of, ideal body weight per day. And really that may be more than what most people are used to. So I do emphasize that right before surgery.
Yeah, and that's, I was going to ask, what is generally your recommendation as far as that goes? Like, do you have a number that you set, or do you just kind of...
It's very high. I say take whatever your ideal body weight. And ideal body weight doesn't necessarily mean the weight that you have to be at, right? It's just what the recommendation is. So if your ideal body weight's 130 pounds, you need about 130 grams of protein.
Okay. Ooh, so you're saying 1 gram per pound ideal body weight. Gotcha.
So that's almost what a bodybuilder swallows.
Yeah.
And I know that it is a lot, but undergoing surgery and healing is like having to rebuild your body. Like, you have to heal the tissue. So it does take quite a bit of protein in order to undergo that healing process.
Yeah. And just so you know, if you want an easy way to calculate that ideal body weight number for women, it's for 5 feet is 100 pounds, and then 5 pounds every inch over that. So if you're 5'6", it's 100 pounds plus 30, so 130 pounds.
That's
for women. Yeah. So, and again, that's like you were saying, this is just an old equation, and it's not what we're aiming for for most people. It's a pretty low number. It's pretty thin, and then it's always plus or minus 10%. But it's just an easy way to do it. And to me, it kind of gives what would your absolute leanest weight be? If we were just feeding a completely lean body, which especially women, no woman is going to have a completely lean body because it's not how we're
Exactly.
designed. And then men, it's a little, it's 106 plus 6 pounds per inch
Oh, that's smart.
for that. So like a man who is, 5'10" is 166.
Yeah. And then patient setup has like so much weight loss. Some of that weight is skin. And then everyone always wonders, well, how much does it actually weigh, right? And it's going to be different for everyone, but it really isn't as much as you think, honestly. But it does range between like 7 pounds to even 15 pounds. And so it's somewhere usually in that range. And at least that's at like one surgery.
Right.
We can't take everything off all at once, or,
Right.
we do have to break things up normally.
So we had a previous episode with you, of course, and we talked on that one a lot about the different procedures you do, how much operative time a patient can undergo. Now we're having patients that have already had their first surgery and they're coming back for their next one. And you talked a little bit about, the arms are necessary to help you to kind of get up. And now some patients are going for their arms next, I think. Is that how you're doing this?
All patients are going to be a little bit different. Some talk me into doing a lot more than I really think that they should do, but they've done well. So every patient is a patient by patient type of decision. And it's a lot of discussion back and forth. How much help do you have? All of these things and factors make us decide what is right for each patient. So what's right for somebody may not be the right order for someone else. But like you said, when you're having your abdomen done, it is better to have your limbs available to help you get up and move around. So usually breast and tummy is a good combination, but some people like to split it up into upper and lower. So doing arms, breast, and maybe back lift, and then the lower body. And that works too. And it's just, I usually ask what bothers you most. And let's focus on that first and get through that one. And then we can kind of break it down after that.
You're doing a lot of our patients, and you're doing a lot of this. I know that this was a big part of your practice in California, but it's a really big part of your practice from our Body by Bariatrics family and community here that are all like very eager to get over and get their consults with you and just talk about their kind of like pain points and things that they would love to enhance and improve. What do you think about these patients and this becoming kind of, I think, really your specialty here?
It's really rewarding. I feel so connected to these patients because I really do sympathize with the struggles that they've gone through. It's been such a journey, and going from, being overweight and not wanting to show their body to now having all this extra skin and still feeling the same way. And to get to the point where I can help them see their body in a new light and feel really confident about it. They've been wonderful.
Oh, we love it. And there's like a little group of them. They're even forming their own little support group.
They do. They have a Facebook group and everything.
They do.
Yeah.
I love it. I know it's such a tight-knit community, and everyone's so supportive of everybody else. And I see patients like sharing like tips and tricks and all this stuff. And it's just really, it's great.
I love it. I love the day that you operate on our patients, and that night they they come into my direct messages and I get all these like naked photos, and I'm like, keep bringing that. I'm like, this is kind of peculiar, I guess, if you were to be an outsider looking at it. And I'm like, wow, like all the fire emojis, like stop it.
Like just gets like unsolicited nudes.
I do.
She loves it.
I love this news. I love it.
I love surgery, please.
Yes.
So I'm used to getting those, but yeah, I guess it may be kind of new for you.
Yeah, I'm like, oh, this is a new one, but I love it. And it's just, but just watching the whole transition, the whole journey it's amazing.
Yeah, it really is. So speaking of kind of our patients, obviously that's who we tend to focus on, but like besides the protein and being steady for about 3 to 6 months, what else, or is there anything else as far as preparation that you recommend? Either mental, physical, like what do you think about that?
So just to touch on physical real quick, it's not just being stable, but being at a good BMI to be at a good place for surgery. And BMI isn't everything. So there's definitely some exceptions, but you want to get somewhere close to BMI of 30. And that may not be reasonable for everybody, but above 35 really increases the risks of wound problems, infections, just things that we don't want to have happen. We want you to have a good, smooth recovery. So if your BMI is still 35 or over, I would encourage you to try to, meet again with you guys, bariatrics, because you guys are so good at helping get people down to where they need to be. And so, kind of just referring them back to me to either follow up with you. Yeah.
Well, that, and I also think that sometimes you might see those people and they get the surgery. If they were to get the surgery done, then maybe they lose more weight afterwards, and now they're not satisfied with their results anymore and either need another surgery or revision or whatever it might be. So that's the other thing.
And I get the excitement, because people have already lost 100 pounds, but even though they're not quite at the right BMI, they're still already ready, and they're already struggling with things that the extra skin is bringing, is like the rashes and the problems and their clothes fitting. And so you get so excited about even the prospect of getting that removed that, you just you push forward. But it's really important to try to be at a really good, safe BMI. Yeah. And like you said, there's also just mentally, right? To be ready to undergo. It is a recovery. It is a process. You have to mentally prepare yourself that it's not going to be instantaneous, one step. If there's a lot of skin to plan out, this can take a full year to get you through all your surgeries before you're going to get to that end point.
And even just those couple weeks of recovery after any of them, I know you said we try to make it as best as possible, as good as possible, but that still can be a lot and be really challenging, and working with your family and caretakers and all that.
Well, it's a lot of prep. You got to make sure that you have support, and that the kids are who's going to take the kids to school, and, who's going to cook for you, and who's, are you going to meal prep before? There's just a lot of planning, and we, try to help out with all of those things, but there is a lot involved, and you have to be ready because it is a big undertaking.
And I'm so impressed by, like you said, there are a lot of details that you just recognize from being, the activities of daily life. But we have a hotel that's right next door.
Yeah.
We have the Home to Suites, and you guys have a very generous offer for that, for the out-of-town patients.
Yeah, we like to, especially if you're driving more than 45 minutes, it's tough to have surgery and then jump in a car and be there for it. So we really do support, you staying next door at the hotel. We'll cover that for you, and the first lymphatic that you have here. So,
oh, wow.
We do have someone who's wonderful. She meets you here at the office. She'll do your first lymphatic, just to kind of help in it. And it sounds like, oh gosh, someone's going to give me a massage the first day. It sounds horrible, but it actually makes people feel really good. And it really does relieve some of the tension that they're feeling in that first day.
Yeah, tell us more about that. I didn't know that you were doing it the very day after surgery. Oh, I didn't know that.
Yeah, so the sooner the better, actually, with lymphatics. And if we wait too long, then already you start getting congestion in your tissues and everything starts to swell more. So the sooner you can start getting those lymphatics to be stimulated and start removing the fluids, the better you're going to feel. And hopefully we can even bypass that really tense, stiff, swollen stage that some people enter. And if we can avoid that, it really does make your recovery so much nicer.
Wow. Can I just get a lymphatic massage?
You absolutely can. It is actually recommended for people to get lymphatic.
Just in general.
It's amazing how much water that your body retains, and just being able to stimulate your lymphatics and get things moving. I mean, anyone could go and get them.
Better up next year.
Yeah. I wasn't aware of everything.
Nice to the woman that comes in. She's very, very friendly.
Yeah.
Oh, that is great. Well, I'm going to take advantage of that. I'm going to tell Dr. Lane in her final days of pregnancy as well that she needs to get over that.
Make sure she can do that.
I mean, her legs are probably...
They're so swollen.
No.
Dr. Lane, I know. She needs some help right now.
I'll love her.
I know. She only has days left. Literally days. We are measuring it in days.
So maybe she'll have my first one.
That's September 11th over here.
Oh. I'll be a little...
Is she really that early? Is she due next week?
She's due October 1st.
Oh, okay.
So she's being induced that day. Oh, wow. So we have, I think, who knows how many surgeries the day before, because we're going to just squeeze. We're working right up to it. We can't add it out. So speaking of squeeze, we're going to squeeze the lymphatics.
Yes.
Squeeze everything back, getting back on track here. Uh-huh. So, okay, so there's the physical aspect. There's also the planning aspect and, taking advantage of you guys covering that hotel stay. That's huge as well. What other things do you feel like you really need to do or know on the front end to make sure that you have just this incredible recovery?
Well, we really try to spell out everything that you need. And we just recently had someone that had surgery with us, and they said, you know, it'd be nice if some of these things were included. So we are going to put together kind of a care package that has most everything you need before and after surgery, just to cover those bases. So you're not sitting there on Amazon trying to find everything that we recommend that you get. And so we're going to try to make it a little bit easier for patients, and just, here you go, these are things that you need. But it's like little things like the foam padding, you know, for under the garment, getting an extra garment, because if you just have one garment, then you want to wash it and that kind of thing. And so just adding a little bit more, value by having you have these things that you don't have to worry about.
Oh, I like that. Awesome. It is awesome. It's so cute. Like, even like your details are amazing. They have sometimes drains, and they have this like little, just like a lanyard, like keychain type thing. This is BodyByBeauty on it. They're super cute. And then she like looks the JPs up to them, the drains up to them. I love it.
It's nice to have something you can take in the shower with you. And,
that makes sense.
Have those drains and just dangle it.
They would like pulls probably that would hurt. And I'm like, man, she thought of everything. Yeah, this is really cool.
Well, it's kind of funny because of the difference between the bariatric surgery and yours. Like, yours is obviously open and it's big incisions and all this, and we're just so used to these like tiny incisions, and we're like, take a 2-hour guard, you'll be fine.
I know,
no big deal.
You're not a Jacksonville. Head on.
You don't need compression garments.
Just get on a walk maybe at a times.
Grab a pillow. You're good.
I know, it's so different.
It is so different.
But I mean, hey, it is what it is.
Ours does not have instantaneous results.
That is true.
It takes a much longer time.
It is true. And I think that is sometimes like you look down and you're like, well, could you remove a little fat in there? We get that question. Or like, I look the same. In fact, you probably gain a few pounds from the IV.
Yeah, with this pumped full of fluid, you're going to be heavier than when you left here. So
exactly.
You're welcome for your weight loss surgery.
Absolutely. So they decide. So even before they decide they're going to have surgery, obviously it all starts with a consult. And you guys you have a deposit that you'll return to them if they attend it. And so you're still essentially doing free consultations.
Essentially, yeah.
That's great. Virtual and in person.
Yep, both. And so we've been doing a lot of virtuals because of the travel package we offer, with the hotel stay. So even if you have to travel in from out of town, we cover the 2 weeks that we want you here in the hotel and your lymphatic. So we've been getting a lot of your older patients, I don't say older, but patients back from Maryland.
Yeah.
We're there. So we get some of that. And, I'm still getting some patients from California from where, I was practicing before. So still kind of getting, it's interesting to me. Like the whole travel for surgery is kind of a new thing for me, but it's working out really well.
Well, I mean, I would absolutely travel for something like this. Like, I'm going to be like, I don't want to be inconvenienced. Like, if I'm going to commit, I'm going to commit. And I think that's what a lot of people think. Like, I want the best results.
Well, you also travel for other doctor's appointments.
I do. It's like dumb stuff, like dentist appointments. Like,
I was like, I'm going up to Pittsburgh for the day.
I do.
I'll be back.
I do that. Okay, that is true. I guess, but
I do agree that this is the kind of thing that like you're looking for a specific result, and it's so visual, and like you offer that.
Yeah.
And not everybody offers.
Oh, yes. I mean, just it's true. It's like, who do you trust? Yeah. And people trust you. And now that you're starting to do like people in the area, oh my gosh, you're getting so busy.
Yeah.
I love it. I love seeing it. This place is like bustling and coming alive. And like I just like pause and I just like stand back and watch. Like I could so easily watch you and like what you're doing and watching your business grow. It's like one of those moments of like, stop and enjoy the view. Like, it is pretty amazing.
No, it's true. It's good to kind of take a step back and just see like how far it's come just in the last like 3 or 4 months.
Yeah, you've barely been here.
Yeah, I know.
I mean, seriously, we did our first surgeries in April. You did your first surgeries in May. And then now, like every month, it's like more and more and more. And now, like closer to the end of the year, a lot of people like to do it during breaks, Thanksgiving break, or the Christmas time, the December period. It's really, really busy for all of us. And so if you want to have that surgery during one of these breaks before the end of the year, if you're a teacher, you want to recover, it's time to get in.
Yeah, those days book up really quick.
Oh, I know.
And also, like, you may not have anything in October, but then you're like, all your November and your December is already all booked.
I know. I was just telling so for us, I was like, we might need to open some more hospital days.
We definitely
In December, we always end up with needing more room. Yeah.
As soon as I get off here, I'm booking that. But yeah, so you're booking up, you're getting busy, people are meeting you, loving you. I think that the biggest thing that people are kind of surprised by is how down to earth you are. And I think that people just really, they feel your sincerity and they feel like, oh, you're here on a Saturday, like taking out drains, looking at them, meeting them. You're just so like approachable.
Well, I just think it's like, I know how I would want to be treated in that situation, and then what would make me feel comfortable. And one of the things is like having that follow up with your surgeon. I think, especially in something that I do, because there's so many wounds and there's like, incisions and all that thing. And any little thing that, people just get uncomfortable if there's any little thing that's going wrong, and then they can't get a hold of their surgeon. So I think that's one thing that kind of sets me apart is you can always get a hold of me. I text my patients. We have a good connection. If there's any questions, they're sending me photos. I'll see them in the office. I see them for all their visits. And so, I don't know. I think it's exactly how I want to be treated. And so that's what I try to do for my patients.
Oh, I love that. Yeah, that's awesome. You're so good. I know, it's actually funny. I was dealing with one of our patients via text earlier, and your husband comes in and is like, hey, this patient just texted me about labs, whatever. And I was like, oh yeah, I'm literally also texting her right now. We got it. We're good. But it was just funny because it was just like immediate response to it.
And that's what's nice about all of us being under the same roof. We can share patients and issues and
coordinate. Yeah,
I can send them back to you. You send them to me, and it works out. And I don't know. It's a good thing we all like each other.
We love each other. Yeah, I love you so much. And I mean, I think that's so true, but this is super unique. I know everybody knows it, but I really do not know another bariatric arm in arm with cosmetic kind of body contouring, nutrition, like truly comprehensive, like I said, like medical weight loss if you need that to help you to get down to that lower BMI, like all these different things so easily and accessible and like really great results. Like, yeah. I don't know any other program in the United States that does this. I really don't.
It's never just under one roof in one place where you can just get everything done.
And the med
that's all it does. So, I mean, everything, all the greatness that comes out of that side.
Yeah,
we're taking advantage.
Yeah, I think I'm draining any profits that we might have. I mean, I go constant. Like she's like, put me in her schedule. Constant.
Yeah, but even there, some of our patients, we've seen some results, especially in facial. I'll show revolving. That was a couple that I was like, oh my gosh, yeah, incredible. I mean, everybody looks great.
Absolutely. Yeah,
the fillers are great, like jaw droppers.
Absolutely, that too.
Yeah.
So we talked a lot about the before, the preparation, staying very close, getting in close touch with you. After surgery, everybody is always like, I want to be the most successful patient. I want to be getting my steps in and all of that. What do you recommend? Is too much too much? Like, can there be?
Yeah, for sure. And I think it's when the patient starts feeling really good. And it's that period between like where the drain comes out and that week right there. Because, they haven't been doing too much. So their drain fluid comes, gets low. And I'm like, okay, let's take the drain out. And they feel great. And then they like go to the mall or they go to Disneyland. They go and then like the next week they're full of fluid. So there's definitely, you still have to be really gingerly about your healing up to at least week 3 or at least a week until that drain comes out. Once the drain comes out, you have to make sure you're not doing too much too soon because now we're just relying on your body to kind of get rid of all that extra fluid that the drain was doing. So if you overdo it, we can kind of, create problems.
Do you still recommend lymphatic at that point?
Absolutely.
Like right after.
I 10 to 16 lymphatics is like,
oh, okay. Well,
it's a lot. It is a lot. And then the more lipo that you get with your procedure, the more contouring that we're going to be doing, you're going to be up on that higher number. If we're just doing skin removal without lipo, there is less of an inflammatory response. So maybe you don't need quite as many, but they're still very beneficial and highly recommended. But there, definitely you can do too much. So I always try to tell patients, even if you feel good, even if you are feeling guilty about not doing dishes or doing laundry, like just let it go. It's really guilty about that. I do. I feel guilty sometimes. But I mean, you just really gotta, it's a short period of time when you think about it. Just let your body heal, because it does take a lot for your body to heal. And if you're doing something else, it's taking away from that healing.
Yeah. And with that too, I mean, from my perspective, you're still trying to get all this protein in.
Yeah.
Like protein is healing. And that's, we've said this before, with any surgery, you need increased protein. Like it's just the standard protocol after any type of surgery. And again, especially with these, when you have these bigger wounds, incisions like that just need, and you want that ideal optimization of healing.
Yeah.
Do you recommend any other kind of supplementation after or during or before?
I think you guys use Juven. Is that the one that
I've in other places.
Yeah.
I know it's been used before. We
don't really. I just I always just find a protein. Like a protein shake is good if you can't eat that much protein a day, and just find one that agrees with you. And everyone's different. I mean, there's some protein shakes that don't sit well with everybody, but just find one that works for you and is palatable, and you're going to actually drink it.
So you like the shakes. For us, once they kind of get beyond the healing pattern and they're off of like the full liquid diet or pureed and they're on regular food, we would prefer that you get it from regular food sources.
Absolutely. Okay. I have the same, but some people have a decreased appetite after surgery, and then they're kind of feeling constricted in the garbage.
Yeah.
So for them to sit there and eat chicken breast, it's just.
And for bariatric patients specifically, they already have that restriction.
Yeah.
And to get 100 plus grams of protein, realistically, you need a supplement.
You need
of sorts.
That's the only reason.
Or clear protein or whatever, yeah.
If you can get it from your diet, I mean, that's amazing.
Yeah.
Yeah.
But yeah, that can be tricky.
Gotcha. And what about those unflavored kind of protein powders, just whatever they do, or do you prefer more of a shake or something like that?
No, it's whatever. Just get the protein in. I don't really care how you do it.
Yeah.
And I know that you do a lot of other things on just weight loss patients, of course. You've done some mommy makeovers, you've done breast augmentations, lipo on the arms only. I've seen all kinds of things.
Yeah, I mean, I like doing a variation, and that's one of the reasons I chose this profession, is because it has so much variety, and every patient's going to be very different. Their aesthetic is going to be different. What somebody thinks is beautiful is not going to be what someone else. And I try to work with whatever. That's what none of my patients are going to look the same.
Okay.
I have a really deep dive discussion on what they want to look like.
Yeah.
What do you see for yourself? And obviously, as long as that's something realistic, that's what we try to do. And whether it's just lipo of the arms or high def lipo of the abdomen or bigger breast, I mean, there's a lot.
So much you can do. Yeah, absolutely. So we kind of got to week 3-ish or so post-op. We've gotten the drains out. I feel like the next biggest question you probably get asked is when can I work out again? When can I return to a totally normal activity?
Yeah. So the most common is, when can I have sex?
Oh yeah. When can I have sex?
And then when can I work out? I usually say when it's comfortable for you and there's no open wounds. So that could vary for people, and I just normally say just keep it boring at first.
Yeah.
But usually at 6 weeks is when someone can, I say, return to kind of gym activity, where they're doing a little bit more heavy lifting, pushing, pulling. But when I say heavy, it's more, heavier, and not really, if you were lifting weights before, not what you were lifting before. But definitely 6 weeks is a good turning point. And if we did any type of muscle work, you can't work out your abs till 3 months.
Wow. Okay.
Yeah. So you have to be pretty careful between that 6 weeks to 3 months not to do too much, because we do use permanent sutures to repair the muscles, but it does take time for that fascia to really seal up and see a good solid repair.
Yeah.
Wow, 3 months. You do have an intensive healing.
I know, you guys are so short, right?
I know. Well, I say the next day they could go back to the gym.
Nice.
Post-op day 1.
Best is like, get in the pool, walk around.
I say you can get a wet, you can go and you can work out after bariatrics because there's just 4 tiny little incisions with waterproof skin glue over them.
Yeah.
And so we do encourage them to move. And so, like, I mean, I want people to be sensible. I mean, it's like cardio, but I don't even put like, you have to wait this long or have this specific lifting restriction. Like, don't put that on them.
Well, yeah, the incisions are like so small. There's no really risk of hernias or anything on those patients. So, I mean, for me, it's like I don't want my repair to fall.
Oh, absolutely. No, totally. It 100% makes sense. And like you're saying, with especially the abdomen repair, which most people are getting that with the tummy tucks or with the skin removal or with whatever it might be. And like, you want that knitted nice and tight back together.
Because it's not just a mommy thing. It is, when you've been overweight and 100 pounds plus overweight, you have that, your abdomen's been
Absolutely.
extended, and there is really a good degree of muscle separation.
Oh, yeah.
The diastasis, right there, all that.
Yeah.
So, do you do interrupted sutures or you run it? Just out of
I
curiosity.
do both. So I do a double layer closure. So the first one is interrupted sutures, and then I do a running suture over it.
Wow.
Yeah.
That's tight, though. That's tight. That's tight.
I want to come and see one of your procedures someday, or some of it.
I always look at
for the whole thing.
It's long. She's long. I know.
My feet will go numb.
Pretty much. So next steps. Somebody is interested whether they want body contouring or just want an enhancement to their physique. How do they get you? How, what is it like, the whole thing?
So you can fill out a consultation form on bodybybeauty.com, just the website. There's a lot of, little areas that you can fill out a consultation. You can always call the office and make an appointment that way. But the best way is to go through the website.
Yeah, perfect. Bodybybeauty.com. Yep. I love it. And it says request a consult right there at the very top in multiple places, and it's easy to find. And I know once they kind of get in, they'll get the consult, and then the texting and all the other forms of communication begin.
Yeah, absolutely. And even if you're not quite ready for surgery and you just want to have a conversation, I'm good with that too. Sometimes people want to prepare and just what is it? And so even if they're not quite stable yet, or maybe they haven't reached that goal quite yet, but it's okay. You can still come and we can talk about the future.
Yeah. And maybe even help them set some of those goals as well. Like, this is where I'd like you to be.
Absolutely.
Because sometimes people are like, man, exactly where to be. Yeah. So awesome. Well, thank you so much for coming back on the podcast. You're always welcome.
Thank you.
She's just down the hall.
Yeah. But it's super interesting. And I know that a lot of people are going to be listening because they've been watching.
There's fan love.
Yeah, there's a lot of analyzing, zooming in on pictures, getting very close. What do they have? Slipping into other strangers' DMs based on the pictures they see. Like, that's me. That's my journey. I lost 100 pounds. I had that same kind of body composition. I want that too. How was it? And our patients, the other thing about them is they love to share, which I know that you're almost like, whoa, I'm not used to that either. They will pay for it when they were trying to decide if they wanted it. They were trying to look for other examples. And so they're like, put me out there. I'm just so thrilled.
I love that. You're right. I'm not used to that. And it was so hard. It was like pulling teeth to get people to want to share their photos, with other people. But I love that they're like that. And it's so important because it makes you feel like you're not alone.
They're not. They're absolutely not alone in that.
And speaking of, I just wanted to say one last thing is that we do have our Body by Mindset retreat coming up very soon, and you're going to be a speaker there. And I think, so if you're attending that retreat, and even if you're not, I think that's an opportunity for people to get to know you. And I'm really excited. And that's something that, yes, this is a community, and we do love to come together, and no one is alone, and no matter where you're at your journey. So
yeah, I'm excited for it. I think people come and find me and just ask me questions and just get my brain with whatever other questions they have.
Yeah, we said she is very approachable and very nice and down to earth. And dryly really funny. I love it.
She laughs at my jokes, you guys.
Yes,
she does.
She thinks I'm funny.
That's why I keep her around.
Well, we can find you on Instagram at Tower Power MD, and then of course at
Dr. Body by Beauty.
Dr. Body by Beauty, and then your website bodybybeauty.com, and then 386 Dr. Tower is the phone number. So you can always give them a call as well. But like I said, go ahead and fill out that consultation form online. Is the best way to get in touch. And then, as always, you can find us on Instagram at the Weight Loss Collab, at hannahschuyler.rd, at Dr. Dovec, at Body by Bariatrics. We're everywhere.
We're everywhere. You can find us. We need to link all the websites so you just
Get there. Yes.
Because we get people all the time that text us like, I want, I want
Dr. Tower.
And I'm like, we type your name a lot too.
Yeah. We do. We're like, this is her phone number. Yeah.
I know.
Give them a call. And then I tell your team, I say, hey, this person's reaching out for you.
Exactly.
We just need to link our website. So
We do.
We will.
yeah.
We'll do that tonight. Right now.
Gotcha. All right. Well, again, thank you so much, and we'll have you back again. Bye.
Bye.